Hello, everyone. Can you hear me? Professor Marcos, Professor Viviane.
Yeah, Camila. Viviane don't participate today because we have some problems in our post-graduation. So
Okay.
I present to you. Okay.
Okay, thank you. Welcome, everyone. We still have 1 minute. No, we don't. I'm sorry. It's for two. Just checking the participants. And we are already recording, so I guess we are ready to start. Professor Marcos, can we test your presentation?
Yeah, I will try to come. But I received a message about the anfitrião desativou o compartilhamento.
Ana Maria.
Oi, Camila. Eu. Como assim? Anfitrião desativou o compartilhamento?
Yes, sim.
Hum.
De tela do participante.
Hum.
E o meu vídeo também.
Só um minuto, just a minute. Bom, eu não fiz nada, gente. Eu acho que só um minuto aqui, eu vou tentar.
We are trying to give Professor Marcos permission to share his screen and also his camera. So thank you everyone for your patience. We're still trying to work with the system here.
Professor Marcos, try it now. Try to
Okay.
share now, please.
So while Professor Marcos starts his presentation, it's perfect. Thank you. I want to say good morning or good afternoon or good evening to everyone. Thank you very much for attending this first webinar of 2024. This is the first free webinar in the research series for NANDA International. So we're really happy to have such a large attendance. Everyone has access, even though we don't have access to the chat, we have access to a question and answer function that is right below here. So everyone is welcome and invited to ask questions. Today we can actually manage questions in English or Portuguese or Spanish. So please be welcome to ask questions in any of these languages and we can work with them. Our presentation will be in English because this is the official language of NANDA International. We do have English speakers, Spanish speakers, and Portuguese speakers, Italian speakers, Japanese speakers here with us right now. So welcome everyone, and our content will be in English. I want to remind everyone that this session is being recorded and it will be made available later in our YouTube channel. So if we are not able right now to understand everything, we will be able to have subtitles later in our YouTube channel. So thank you very much. Today, our presenter will be Professor Dr. Marcos Vinicius Lopes. He is a professor at the Federal University of Ceará in Brazil. He is a member of the research committee. He is a fellow of NANDA International, and he is a renowned scientist in the area of nursing process, nursing diagnosis, validity studies. We also have as a co-presenter who will unfortunately not be able to be here with us today, Professor Dr. Viviane Silva, who is also a member of the research committee, a fellow of NANDA International. She's also a professor at the Federal University of Ceará, and she coordinates the graduate program. So she has a lot of issues to manage in the graduate program. So that's why, unfortunately, she will not be able to join us today. Professor Marcos, please, if I don't know if you can turn on your camera, but
my camera is not disponible for me,
Okay. Oh, so please be free to do your presentation. Thank you very much for accepting. I am very honored to be here with you truly today and to have the opportunity to hear you one more time. Thank you very much.
Thank you, Camila. Did you hear me? Did you hear me? You hear me okay?
Yes, we can hear you clearly and we can also see your presentation very clearly.
Okay.
Thank you.
Thank you. Good afternoon, everyone. Sorry, my English is not good, but I will try to be clear in my presentation. And this presentation was prepared by me and Professor Viviane Silva. We work at the Federal University of Ceará, like Camila said. And today we present for you some methods to use in research on concept generation theoretical support. We divided our presentation in 4 moments, okay? The first and the second moment are small, we need few time, but I need to clear some things to understand better these methods of a concept analysis and theoretical support. I will be present for you. But our focus will on the methods for concept and theoretical support, okay? And in this first moment, I need to present for you a little bit difference between concept and constructs, because this is important to understand what results we will be obtained. We use different methods. So there is a long discussion about this difference, but I recommend read this article written by Dr. Keith Marcus. Dr. Keith Marcus is a psychologist. And in this article, he discussed this difference. And in resume, Professor Marcus defined concepts as independent of the population, representing counterfactuals. In other words, concepts are possibilities, okay? And constructs are dependent of population. So when we use some concepts analysis models, we need to care to interpretation, because we find some articles use the notion of construct analyzing like concepts. And this is I will be present some examples to better understand. And we need to clear to how to consider nursing diagnosis in the context of nursing research. Professor Marjorie Gordon, present a difference between nursing as a process and nursing as a product. If you consider for example, the model proposed by Professor Kay Avant and Professor Lorraine Walker, and that model by these authors was developed to analysis of concepts in general, not specifically to nursing diagnosis. So sometimes researchers, when using this model, tend to consider consequence some like something outcomes, for example, because the attributes in this model are defining like defining attributes. So some researchers trend to use the definition of attributes like defining characteristics. There is no problem to use this way, but we have some difficulties when we try to specifically we try to define the structure. For example, if I use define characteristics like attributes, our consequence, what will be our consequence? Because the consequence in this case will be outcomes, and outcomes don't compose our nursing diagnosis structure. And we have other problem. And if I use attributes like defining characteristics, what element I can use to construct our definition? Because NANDA don't recommends the use defined characteristic in the definition. So we can use the concept analysis methods in a different way, considering nursing diagnosis as a process. In this case, consequence will be defined characteristics. And the attributes will be used to construct a definition, and antecedents will be the related factors. Its factors have promotion factors. Okay, so I think when we use nurse diagnosis as a process, when we implemented a concept analysis, we will obtain a more logical structure for in our research. These things are very describing in this article. I writing with Professor Viviane and Professor Heather, and this was published in NANDA journal. Okay. So if you consider these two things, concepts, constructs, and nursing diagnosis process or product, we can understand better how to use the different methods of concept analysis. There is a lot of different methods for this, but today I will try to resume 6 methods for concept analysis and how can you use for research about nursing diagnosis. We describe the Walker event method as maybe the most frequently method used by nursing diagnosis. But we have other methods, including the evolutionary methods, hybrid methods, Norris methods, dimensional analysis, and simultaneous concept analysis. I will try to resume all these methods. The first methods I said for you is the most known and the most used method in the research about nursing diagnosis. In general, this method is used to construct a diagnostic framework. Okay, and this book is a very interesting book, but this book included 9 different models to analyze concepts, theories, statements, methods to derivation. So, but I will present only the method related to concept analysis. Okay, I recommend you read this book. It's very interesting to know other methods, including this book. So for the method of concept analysis by Walker event included 8 steps. Okay, the first step is concept selection. In general, this step is something simple, but I am find some difficulties. For example, if you have the dysfunctional family process, for example, what the concept as dysfunctional family processes, dysfunctional family processes. This is interesting because we will be influencing our search strategies for the material to use to develop our concept. So sometimes the concept selection can be some problematic, maybe. For other example is to use for diagnostic respiratory nursing diagnosis. What the concepts to an effective brief pattern is brief pattern, ineffective pattern, ineffective briefing, ventilation. So we can found some difficulties to define what the concept, specific concept we needed to trace, we need to search. So this is a very common doubt, okay? The second, after you define the concept, we can, the second phase is the determination of analysis objectives. This phase is directly linked by the first. Okay? If our objective is to analyze, to construct a diagnostic structure in general. The third step is identification of possible use of the concept. Here we can to identify different articles using a diagnostic concept in different scenario, different populations, and we can compare this use to more clear to clear our concept. The fourth is determination of defining attributes. Here we have some problems. If you use attributes like defining characteristics, we have some problems with consequence. Consequence will be outcomes or something like this. If we use attributes like elements to construct the definition, avoid defining characteristics, the sixth step, identification of consequence sentences, consequence will be more clear, because the consequence will be defining characteristics. Okay. After deciding what model you use, we need to construct a model case. In general, some researchers report some difficulty to construct with this model case. For example, if you define your concept like a dysfunctional family, the model case will be describe a family dysfunctional, right? But if you define your concept like a family process, the model case will be describe a family process natural, for example. Okay? So depending on the concept you select, we can different model cases. So this can be problematic in this step. Right? Other step is construct additional case. Here we have boundary cases, contrary cases, but the authors describe this is not there is no obligation to present the additional case. The main case to present is a model case. And I found two researches describing difficulty when work with a positive concept, for example, ventilation, ventilation representing the diagnosis of ineffective breath pattern. And when construct the model case of ventilation, maybe we'll find positive cases as a normal ventilation. So when we needed to describe the nursing diagnosis, we need change for another direction, okay? And transform the model case in a contrary case. So I find some researchers describe this difficult. The sixth step is identification of antecedents and consequences. In nursing diagnosis, antecedents can be represent risk or related factors and consequence. I think the ideal way is the consequence representing defining characteristics, because we have all elements for nursing diagnosis: attributes related to definition, antecedents related to risk factors or related factors, and consequences representing defined characteristics. But we find in the literature in another way, and maybe people using another way, maybe the research is related to nursing diagnosis as a product, not a process. Okay. And the last step here, a definition of empirical reference. Here, we can construct definitions to evaluate the antecedents, consequence for a nursing diagnosis. It's a very interesting model. It's maybe the most frequent model used to nursing diagnosis. But there is another methods. Here, we have an example to use the Walker event method. And this article doesn't relate it to nursing diagnosis, but use a concept more close to nursing diagnosis. The article, these authors study the concept of caregiver burden. And if we read these articles and we concentrate about this figure 2, we identify antecedents very similar to risk factors or related factors, and insufficient financial resources, multiple responsibility conflict, lack of social activities. The attribute is very similar to main elements to construct a definition, a self-perception, multifaceted strain over time, and the consequence is very similar to defining characteristics. Okay. So when we use the Walker event in this way, when we finalize our study, we have more close a nursing diagnosis structure. Okay, and these authors use electronic database search using Medlines now, and this figure 2 is the resume of the results described by the authors. Okay? Another method very interesting to nursing diagnosis is the evolutionary method by Rogers. And these methods, the main characteristic of these methods is to consider interdisciplinary and sociocultural and temporal variations. So it's an interesting method to understand better chains, identify chains of the concept. So I understand the interesting application to this method is to use for review prognostic characteristics that can be changed on the time and influence the human response. So this method is more short in their description, but include maybe the same steps of the Walker event methods. The basic difference is to use to consider, interdisciplinary and sociocultural variations. But in resume, this method has 5 steps. Identify the concept of interest, similar to Walker event. Identify appropriate scenario and sample. Here we have a very interesting difference. And the Rogers evolutionary method consider the possibility to develop a concept based on a specific scenario and a specific sample. In the author described too, we can use a sample at least 30% of the material used. This is a difficulty reported by some researchers using other methods. When we search material on databases, in general, we found a lot of different articles, and the manipulation is very complicated because you read 7,000 articles is a lot of work. So Rogers describing in their method, in her method, that we can use a sample, and she recommends use 30% sample. But this is not a rule, a statistical rule, it's a recommendation. Okay. Identify appropriate scenario. We can consider the attributes we can find, interdisciplinary variations, sociocultural variations, time temporal variations, and temporal variations here. The author considered the difference between antecedents and consequences. So this is more common steps of the more as sorry these are the main characteristics of relevant data. Okay, and the next step is analyze the characteristics of the concept. Okay, to with the objective to construct a structure of the concept. In nursing diagnosis, this is related to identify the main elements, define characteristics, related factors. And the last step is identify hypotheses and implications for concept development. Here, the author considers important that we analyze what we need to do after identifying the structure. What things can be changed or can be modified when identify this concept on the clinical practice. It's an interesting method too. Here we have example using evolutionary methods. These authors study the concept of spirituality using the Rogers approach, and they are based your results in literature search literature. This literature will extend from 1972 to 2005, and the main result is the concept of spirituality. The spirituality here is a way of being in the world in which a person feels a sense of connectedness to self, others, and or a higher power or nature, a sense of meaning of life, transcendent beyond self, everyday living and suffering. So we can use this definition, for example, to construct or revise our definition of nursing diagnosis spiritual distress, because this article considered different context aspects to construct a spirituality. The third method of concept analysis is very, very interesting. The previous methods is based on literature, searching literature in databases. A hybrid method use three phases: a theoretical phase, a fieldwork phase, and an analytical phase. So the first phase is similar to the previous models, okay, previous methods. Include the selecting concept, searching the literature, dealing with meaning and measurement. Here, measurement is related to construct the empirical reference, okay? And choose a working definition. It's construct a definition of the concept. So the theoretical phase is some similar to the previous methods, but the authors of this method consider the need to develop a fieldwork phase, is go to practice in scenario and to identify how the concept is present, is structured on the specific scenario. So this phase has 4 steps. The first step is defining the setting of the collection, data collection. The second phase is negotiation the entry. In other words, we need to identify a scenario to collect data and search, establish a contact with responsibles about this scenario to start our data collection. The third step is selecting case. In their scenario, we needed to identify patients, families, professionals related to the concept to analyze the case of the concept. Okay, and the last step of the field work camp is collecting and analyzing data. So in this model, we can compare and analyze the similarity and difference found in the 2 phases for weighting, work, and write up the findings in the final phase, analytical phase. So this is an interesting method, but it's a very hard method because we have at least 2 data collection. But it's interesting the development of this method. Here we have example using hybrid method. Is a method used for chronic disease of self-management. I understand these results can be used, for example, to related nursing diagnosis and effective health self-management. Okay? The authors developed the 3 phases. The first phase is similar to previous methods of using the literature, and the field work. The authors interview, I think, 5 or 6 patients with epilepsy, and join the results and analyze these results and construct the definition and the characteristic of the concept of self-management here. The Norse method is another method, another interesting method, but it's a dated method. I think this method was created in 1980 years, I think. And the objective of Norris was to propose a method to clarify concepts in practice. So in general, Norris recommends use her method in a practical environment. Of course, there is a search in literature, but the search in literature is not a main objective here. The main objective here is to clarify the structure of the concept and in the practice, in your use. So this method has 5 steps. The first step is observing and describing the phenomenon and the scenario, practical scenario. Okay. Systematizing the observation, developing operational definition, construct a model, and develop hypotheses. Look, this method is very interesting because it's very practical. Okay, but I'm surprised because when I'm searching examples to using these methods, I found a lot of use based on literature review, and this is not the proposed the idea presented by the author, by Norris. Okay, but I don't found people using the Norris methods in a practical scenario. Okay, but the idea of Norris is a using practical scenario. Here I have an example using Norris method, but based on review of literature. Okay? And so when we use Norris method based on the review of the literature, we have similar results when we use the Walker-Avon method or evolutionary method. There is no a clear difference. Okay. This article, for example, studied the resilience in nursing students. Maybe we can use the results to revise or clarify our nursing diagnostic impaired resilience. So the figure 1 is a resume found by authors. Okay? The next method is the dimensional analysis. This method is very interesting because it's based on symbolic interactions. So it's a method related to social construction. So it's a very qualitative method. Okay? So the first step to this method is similar to the previous method. Define the concept, okay? And the select source information. Here we can use books, articles, or other information to construct our concept. The third phase is describing the social construct of the concept. So here we have a great influence of the symbolic interactionism here. This method is based on interactionism symbolic, okay? Symbolic interactionism, sorry. And the next step is describing the logic of the concept from multiple perspectives and as part of multiple contexts. This method and the evolutionary method is interesting because both consider important to use other perspectives, not perspectives uniquely based on nursing perspective, but we can use different perspectives for other professionals. And so this is very interesting because for a long time, we consider to develop a nursing diagnosis based unically on the nursing perspective. And today, we consider important to hear about the same concept on the different visions and different perspectives. So this method, the different perspectives, a core is very important. Okay? And the next step is differentiating the relationship between perspectives and use or definition of the concept. So here we try to resume our results. Okay, from different perspective, we can construct a new perspective of this concept. And finally, we create assumptions for that concept. In general, these assumptions is based on social theory. This method is interesting. I have the same difficulty with this method, similar to difficulty I found with Norris methods. This method include a practical phase, to collect data with people, with patients, and in general, people use this method based only review literature or literature review. Sorry. So, but this article about dimensional analysis of the concept of obesity is very interesting because obesity is a clinical concept in general related to nutrition, for example, exercise, physical aspects. But here, this article presents other vision about the obesity, the vision, social vision. So here, we can find, for example, related factors or risk factors to obesity. For example, the authors found difference and related in difference in assumption, use, and meanings of the concept of obesity across the Black, American, Caucasian, and Latin American cultures. In other words, the cultures can be influenced the understand how people understand obesity, and the obesity can be a positive aspect or negative aspects. In the past, we know the when we have a body with more weight, for example, is okay. But today, the weight is not good. We have a high weight is something not considered interesting, mainly for women. So this article present risk factors interesting to obesity. So, and the last method for concept analysis is a simultaneous concept analysis. This method maybe the most complex method, because here we compare two or more concepts with the objective to clarify the difference in similarities. So it's very interesting when we have construct criteria for differentiation among these nursing diagnoses. And this method has seven steps, but one step is the clarification of individual concepts, and the authors recommend the use of the Walker-Gibbon method. So we have a method into other methods. It's a very complex method. So the first step here is develop a consensus group. But if we have, or our objective is to analyze, for example, 3 concepts, our consensus groups needs to at least 4 people. One person will be the coordinator, and the other 3 members will be responsible to analyze each concept. So we need to define our consensus group. And the second step, with the selection of the concepts to be analyzed, and this phase obviously is related to the first phase, because to define a consensus group is dependent on the concept will be analyzed. The third phase is the clarification of individual concepts. So the authors recommend each researcher develop a concept analysis, use the Walker-Evans method for each concept to analyze. So if we have 3 concepts, we have 3 concept analysis independently. Okay. After this is a lot of work. No, the fourth phase, we needed to develop validation matrices. These validation matrices include the main aspects found when we develop the Walker-Evans method for each concept. After construct this validation matrices, the group will be revised of the individual concepts considering the similarities. And this group will re-examination of individual matrices after revise or the group of concepts, and finalize with the procedural model development. Okay. Here we have an example using simultaneous concept analysis to nursing diagnosis. Here we develop a study with 3 nursing diagnoses related to respiratory function. And this figure represent the main result. So we have three graphics with intersections, okay? The elements specific for each diagnosis, there is no intersection, okay? And we have on the center, we have 5 elements that are 5 elements characterizing all 3 diagnoses, nursing diagnoses. This is composed the structure of the all diagnoses here, the 3 diagnoses. Okay. So this article describes each step, and in this article, the simultaneous concept analysis was used to specific nursing diagnosis. So this is the main methods used today for nursing diagnosis, but there is a lot of models we can use to concept analysis, and you can search recent books about this. I think there is a book is Concepts in Nursing, a New Approach. I don't remember the authors. Is other model using a Wittgenstein, philosopher Wittgenstein, to base it to develop concept analysis. It's a very interesting book too. But the final thematic today is the method of theoretical support. These methods are very used in the research of nursing diagnosis. We have middle range theories and specific situation theories. Both can be developed using 8 steps. We have selection the diagnostic concept. The second, we determine essential attributes for diagnostic definition. Yeah. Third, identification of clinical indicators. This is similar to consequence by concept analysis. The fourth step, establishment of etiological factors. This is similar to identify antecedents in the concept analysis. The 5 steps, constructor of constitutive and operational definitions. These steps similar to constructor referent, empirical reference. The 6th is construct of a pictogram. Okay? And the 7th step is description for propositions. The final step is description of causal relationships. And so here we try to construct a theory to base our nursing diagnosis structure. The difference between middle range theory and specific situation theory is obviously the population or environment we can use this theory. Middle range theory is more general. In a specific situation theory, define a specific scenario, population, or both. So how can get data to develop theories, middle range and specific situation theory? We can use integrative systematic scope reviews. We can obtain data from observation from practice, by expert opinions, nursing theories, theory from the other disciplines. So we can use different material to develop our middle range theory or specific situation theory. So we have an example to the middle range theory. This middle range theory developed by nursing diagnosis of low self-efficacy in health. There's a new nursing diagnosis will be included in the next edition. In the next edition, I think it will be present in April. I don't know. I think Camila can be detailed when book will be presented for us. And here we have the main results. There's the relationships of etiological factors. In this article, we have another figure with clinical indicators of this. And here we have a specific situation theory as a theory about the nutritional deficits in children with cancer as related to nursing diagnosis balanced nutrition less than bar requirements. And if you pay attention, we need to realize this. The first theory is more general. We don't have any specific population, but here we have a specific population, children with cancer, okay? But both articles use the same methods to construct. But we have another strategies that is used, for example, systematic reviews. Here we have two systematic reviews, systematic reviews for clinical indicators and systematic reviews for etiological factors for the same nursing diagnosis for the same population. It's the same research developed both, and she is using now these results to construct a specific situation theory for this nursing diagnosis. Okay, so there is a lot of different methods we can use. This is some examples, but I'm sorry if my English is not good, but I'm trying to be more clear, okay? But to finalize my presentations, I need to highlight that concept and theories is very important to support a clinical reasoning. Okay, and the absence of the theory or concept analysis can be reduced our nursing diagnosis to a list of terms with different interpretations. So concept analysis and support theory supply our nursing diagnosis with adequate interpretation. Okay. And this structure, conceptual, theoretical, can be facilitating the teaching of the nursing diagnosis because it's more logical, and we have how to explain why to evaluate in specific clinical indicators, why it's important to understand the causal inference and other things. So thank you. This is our contacts, me and Viviane, and I can try to answer your questions if you have. Okay, thank you so much.
Thank you very much, Professor Marcos. It was so, I feel it was so difficult to summarize such a complex content, and I think you did a phenomenal job as usual. So thank you very much for taking the time to share all of your knowledge and your expertise with us. We do have 5 questions that some were in Spanish, so I put them all in the chat so everyone could see them. The first question is actually mine, and this is something that we have been struggling with in the DDC, the Diagnosis Development Committee, because we adopt the understanding of your middle range theory of differentiating nursing diagnosis as a product or a process. So we have been trying to understand the structure as a spectrum where an individual might have a different level of severity of the diagnosis. So he will have more defining characteristics or more severe defining characteristics compared to someone who is in another spectrum of the diagnosis. So my question is, in your opinion, is there a limit for especially the consequence in when we are doing a concept analysis to build the structure of a diagnosis? And the major example that I have is decreased quality of life. I feel that for many concepts that we analyze, decreased quality of life will be a finding as as a consequence. So is it the case where we should have decreased quality of life as a defining characteristic in several diagnoses? Or is there a limit in your mind where you do not have them as defining characteristics, but as something, the consequent of the consequent?
And okay, this is an interesting question. Yes, there is a limit, but this is a theoretical limit. Okay, in practice, maybe we need to consider the sensibility and specificity defined characteristics. So in other words, we need to consider the quantity of defining characteristics, but the quality of the defining characteristic. In general, we need at least two defining characteristics. One sensitivity characteristic to indicate a possible diagnosis, and a specific characteristic to confirm the diagnosis. So this situation is relative as common, I can say, because when we start to assess a patient, we don't have what nursing diagnosis we find. So we collect different data, and when start clinical reasoning to search a group to name it this group, it's very common. We have debates between when I can put a defining characteristic with one diagnosis, another diagnosis, both diagnoses. So I think this limit is there is this limit, but it's theoretical, and we can facilitate the decision based on the sensitivity and specificity for each defined characteristic found. Okay. I reply your question.
Yes, you definitely did. And so for us to be able to get there, we will definitely need studies on the same diagnosis in several settings, in several contexts of care, several populations. So we obtain the data on sensitivity and specificity for the defining characteristics. Is that right?
Yes.
Okay. Thank you very much. So the next question is, Professor Lopez, in the is the field phase, I am not sure I have the right name, the field phase in the hybrid method comparable to an accuracy study where we analyze which elements are sensitive or specific for a nursing diagnosis in a given context of care? It's the hybrid methods.
Yeah, hybrid methods.
Field work phase.
Yeah, not necessarily. You can use the phase camp to develop a accuracy study, but this is not common. The idea of the fieldwork phase is to confirm or clear the structural concepts developed in the theoretical phase. So we try to obtain other data to construct a diagnostic structure. Okay, the accuracy study is a more specific study when we have a structure defined, and we evaluate our patient to the presence or absence of each element, and we can measure the sensitivity and specificity. So it's possible, but this is not the objective in the hybrid method. Okay.
Thank you. So whoever asked the questions, if you feel that you need extra explanation and you want to say something here in the question and answers, I can let Professor Lopez know. Our third question is, Professor Lopez, how can you identify the surrogate terms and relevant uses of the concept that you want to analyze?
Oh, good question. And this is hard. This is hard. And surrogate terms is treated in the Walker event method with we develop cases. There is a boundary case. I don't know the specific term the author use. But in this case, we develop a situation with the limits of the main concept is very close to other concepts. And to identify the surrogate terms depends on the clinical characteristics. For example, the surrogate terms is very complicated to identify when we treated with psychosocial nursing diagnosis. In general, for biological nursing diagnosis, the surrogate term is not a problem, but psychosocial nursing diagnosis, yes, we have some problems. And maybe we need a dictionary for this, because the terms, sometimes the terms is very, very similar. I don't, I'm trying to remember a situation this we passed, but my memory is not good today. And we identify surrogate terms. Maybe, how can I mean, in English is so hard for me to explain this, but it's so hard to explain this without example. But
May I ask you of something that I asked you before, and if this is an example of using the terms interchangeably of self-esteem, self-concept, and self-image?
Yeah, in general, surrogate terms will be present when we develop simultaneous concepts analysis. And I think there is no recept to this, because it depends on our knowledge, previous knowledge, and our reading we can develop during the process of research. And simultaneous concept analysis is a very interesting method, because the surrogates will be fine. They will be we find the situation, because it's the focus on the simultaneous concept analysis. But it's very hard to this discussion in that word, I'm sorry, about a moment, please. Here, to define this, to found this structure was very, very complicated. We have a lot of meetings to discussing, to clarify, and so I think it's interesting maybe read this article, and there is another article developed by Professor Silvia Caldeira, and she studied hope. I think I don't know, two or three concepts related to hope. And in that article, there is some discussion about this too. I'm sorry, I don't know if I reply our colleague. I'm trying.
This person is anonymous, so if the person who asked the question wants to tell me in the questions and answers function, if this is clear. Professor Marcos, is this concept analysis that you're mentioning about spiritual comfort, spiritual support, and spiritual care?
Sorry, Camila, can you repeat?
The simultaneous concept analysis that you mentioned, by Professor Silvia Caldeira. Is this about spiritual comfort, support, and care?
No, it's another. I think it's about. I remember the hope is one of the concepts, but I don't remember the other concepts.
Okay.
And
We
okay,
can ask her and send everyone the example because I was trying to find it here. But that's okay. We can ask her and send everyone this example of a simultaneous concept analysis. Do you want to add anything, Professor Lopez?
sorry.
Do you want to add anything?
No.
So our fourth question is, what are the advantages and disadvantages of the simultaneous concept analysis considering other methods? And what data analysis or data analysis strategies could be operationalized or used?
Okay. The advantage of the simultaneous concept analysis is the possibility to analyze two or more concepts in the same research to the same time. Okay, and the other methods don't develop into this use, and the simultaneous concept analysis was developed specifically to this. But the advantage is the complexity of the method, because we have one method into other methods, because the authors recommend use here the use of the Walker-Evans method for each concept. So this is make the method very complex. And we need to group that in the other methods. We can develop one researchers only the method, but in this we need a group. So it's very complex, but it's a very interesting method to differentiation of nursing concepts. I don't know other method to use this. Okay, and how to operationalize it? Oh, we need a very interesting group to develop work like this. And we need a group with experience to use Walker-Evans methods. So, and we need time. We need this thing to develop this method. It's a very interesting method, but it's complex method. Yeah.
Thank you, Professor Lopez. And the fifth question is, in which occasions would you recommend a concept analysis for a specific population?
On specific population as concept analysis.
Yes.
It depends on your objective. If your objective is to highlight the social aspects, dimension analysis is perfect. If you had the objective to clarify practical use, Norris method is perfect. If you have the objective to analyze multiple concepts, his simultaneous concept. And if you have the objective to identify different aspects of the same concept in different areas, different scenario, the evolutionary method is interesting. And the Walker-Evans is a classical method that we can use. So I think that depends on the objective. So if you have a specific population in practical, maybe I recommend the Norris method, for example. It's a very interesting method, but it is not used adequately in my vision. In general, or the majority of articles I found using the Norris methods, using based on literature review, and Norris method is based on observing on the clinical scenario. I like the Norse method. That's a very interesting method.
Thank you, Professor Lopez. And so our last question is, first there is a comment, great presentation, Professor Marcos. Thanks for sharing your knowledge. I have a question. In your opinion, do you think we need to apply these methods, theories in nursing diagnosis in different populations, and what gain would we have in nursing practice?
It's I think depends. It depends. In general, concept analysis directed to construct a general concept, now a specific concept or a construct. Okay, but we can, using, for example, evolutionary methods, define a specific scenario and study this nursing diagnosis in a specific population. So if you develop a concept analysis, maybe you need to include the different populations, and with this we have a more generalized structure, okay? But we have some problems with this. When, for example, we search about low self-efficacy in all different populations, we can find thousands of articles. So this is very complicated. The evolutionary methods have an interesting strategy. Rogers, I said, Rogers recommend use samples, specific samples, and recommend 30%. This is a recommendation, it's not a statistical criteria, okay? And so if you consider interesting to analyze a concept in different populations or scenario, we can use the evolutionary method for this, okay? And what gain have practice? Well, if we gain our practice can be oh my God, our gain is we have a practice with more directed for the evidence generated, because these methods in general are based on review literature, systematic literature. So we can resume of evidence, clinical evidence. So we contribute to a clinical practice based on evidence levels. And we can direct our research in the future more focus on our interesting or focus on the nursing diagnosis specific, okay?
Thank you very much, Professor Lopez, for all of your questions. First, for taking the time to do this presentation, and then taking all of these questions. Thank you, everyone who participated, and especially those who asked these very interesting questions. I left you the link to the recording in the NANDA-I YouTube page, and then we'll be able to use subtitles there for those who do not speak English. Professor Marcos, I cannot thank you enough for being here with us today. And we'll see everyone in the next webinars of the research series. Thank you very much for the attendance.
Thank you, Camila. Thank you.
Thank you. Let me stop the recording.